Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, Emily. I understand that you were referred to me by your general physician because you've been having some sleep difficulties. Is that correct?
Yes, that's correct. I've been struggling with sleep for a while now. It's gotten to the point where I can't function well during the day.
I see. How long has this been an issue for you?
I'd say for about 2 years, but it's really worsened over the past 6 months.
That's quite a long time to be dealing with sleep difficulties. Have there been any significant changes in your life recently?
Well, I started a new job about 8 months ago, and that has definitely been stressful. But I've also moved cities, so maybe that could be affecting me too.
Those are 2 significant life changes indeed. What happens when you try to go to sleep?
I lie there for what feels like hours, tossing and turning. Sometimes I fall asleep, but wake up multiple times during the night. I've also had some nightmares.
How do you feel during the day? Are you able to go about your daily tasks?
I feel really exhausted. It's hard to concentrate at work, and I've even dozed off during meetings a couple of times. I feel like I'm not performing at my best.
That must be difficult for you. Have you tried any remedies or medications?
I tried over-the-counter sleeping pills, but they make me feel groggy the next day. I've also tried herbal teas and meditation, but nothing seems to work long-term.
It sounds like you've tried various methods to address the issue. Have you ever spoken to anyone about the stressors in your life?
Not really. I've always been the type to handle things on my own, but it's been really hard lately.
Stress can have a significant impact on your sleep quality. Have you noticed any patterns or triggers that make it worse?
Work deadlines definitely make it worse. I also struggle when I know I have to get up early the next day for something important.
So it sounds like you've noticed that anticipation and stress are contributing to your sleep issues. What goes through your mind when you're lying in bed trying to sleep?
I keep thinking about all the things I have to do the next day or mistakes I made during the day. Sometimes I also think about embarrassing moments from years ago. It's like my brain won't turn off.
Those racing thoughts can definitely make it hard to fall asleep. How does that make you feel?
Frustrated and increasingly hopeless. I feel like everyone else can sleep just fine, and here I am, unable to even get a few hours in. I just want to be able to sleep and feel rested.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello there, Sarah. I'm Dr. Martin, the chiropractor here. How can I assist you today?
Hi, Dr. Martin. I've been having really annoying neck and shoulder pain for the past few weeks.
I'm sorry to hear that. Can you describe the kind of pain you're experiencing?
It's a mix of dull ache and sometimes sharp shooting pain. The pain seems to radiate from my neck down into my shoulders and sometimes even into my upper back. It's worse when I'm at my desk working.
How long do you usually sit at your desk each day?
Oh, I have a desk job, so probably around 7 to 8 hours, not counting the time I spend on my laptop at home.
Okay, have you experienced any injury or trauma to the neck or shoulder area recently?
No, not that I can recall, but I have been under a lot of stress recently, and I tend to carry my tension in my shoulders.
Stress can indeed contribute to muscle tension. Do you do any physical exercises or activities to relieve the stress?
I try to do some yoga and stretching, but I haven't been consistent with it.
Have you sought any treatment for this pain before coming here?
I've seen a massage therapist a couple of times. It provides temporary relief, but the pain keeps coming back. I've also tried using a heating pad.
Did the massage therapist focus on any specific areas?
Mainly the upper traps and the back of my neck. She also did some work on my scapula area.
All right. What about over-the-counter medication? Have you tried anything?
Yes, I've taken some ibuprofen when it gets really bad, but I don't like relying on medication too much.
Understandable. Have you been given any exercises or stretches by the massage therapist or anyone else for this issue?
She recommended some neck stretches, like tilting my head from side to side, and some shoulder rolls. But I haven't been disciplined about doing them regularly.
Would you be interested in exploring some adjustments and perhaps some more targeted exercises to help with this?
Yes, definitely. Anything to get this sorted. The pain is really starting to interfere with my work and overall well-being.
All right, let's begin by doing a thorough examination of your neck and shoulder area. Based on the findings, we'll discuss a tailored treatment plan that may involve some spinal adjustments, exercises, and possibly some lifestyle modifications.
Sounds good to me, Dr. Martin. I'm really hoping to find a long-term solution for this.
Excellent. Let's get started then. Thank you for giving me a detailed background. It will help in providing a more personalized treatment plan.
Thank you, Dr. Martin. I appreciate your thorough approach, and I'm looking forward to getting some relief soon.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Hi, I need to schedule a physiotherapy session as soon as possible.
Sure, may I know who your regular physiotherapist is?
Dr. Williams.
Is this an emergency? Did you have an accident?
No, it's not an accident, but my back pain has gotten significantly worse.
I see Dr. Williams is booked for today, but we have an opening with Dr. Smith later this afternoon.
That's fine, but will Dr. Williams be available tomorrow?
Yes, we could fit you in tomorrow morning.
I've been doing exercises Dr. Williams recommended. Maybe it would be better for her to assess what's going wrong. I can wait until tomorrow.
Sounds good. I'll book you for the first appointment with Dr. Williams tomorrow morning.
Now look at question 26.
So, I'm sure you've all received the memo about our new telemedicine initiative, and you probably have mixed feelings about it. While it's clear that telemedicine has its advantages, especially in reaching patients who can't easily come to the hospital, it also brings new challenges. Some of you may be worried about technical difficulties or concerns over patient privacy. To ease these worries, we are implementing stringent protocols for online consultations. But what about the added workload? That's a fair question. Our aim is to integrate telemedicine smoothly without overburdening anyone. We've got a team specifically trained for the telehealth services to handle the additional load. Also, patients will receive a guide on how to set up their systems and what they can expect, minimizing disruptions to you. So our routines will not be disrupted. Exactly. We are setting it up in such a way that it should enhance our healthcare services, not hinder them. Management will be tracking the process closely to ensure everything runs smoothly.
Now look at question 27.
Mr. Johnson seems to be recovering well after the bypass. When can we move him to the general cardiac unit?
He should be transferred within the next half hour. All his vitals are stable so far.
Good. I've ordered some additional blood tests. I'm concerned about his clotting factors, given his history of deep vein thrombosis. Make sure we're checking his D-dimer levels and doing regular leg scans.
Understood. I'll add notes to monitor for signs of clotting like leg swelling or chest discomfort.
Excellent. Keep me updated on his progress. If anything changes, don't hesitate to call me.
Now look at question 28.
Our next patient, Emily, has been dealing with chronic lower back pain. We've tried physical therapy and NSAIDs, but she's still experiencing discomfort. This is her first day for acupuncture treatment, correct?
Yes, that's right.
We're going to start her on a weekly regimen of acupuncture to target her specific pain points.
Along with that, we'll also incorporate some cupping therapy to promote blood circulation. This combination has been effective for some of our other patients.
That sounds comprehensive. Are we planning to continue her on her current medications?
Yes, for the time being. The acupuncture and cupping are complementary to her existing treatment plan, but we'll reassess as we go, particularly if she shows significant improvement.
Great. I look forward to seeing how she responds to the treatment.
Now look at question 29.
It's tempting to think that once the surgery is done, the patient is out of the woods. But postoperative infections remain a significant concern, especially in emergency cases. Our hospital has done well in controlling these rates. We're at a 5% infection rate as opposed to the national average of 9%. In emergency cases, you won't have the luxury of time to prepare the patient, and they may already be in a weakened state. You've got to be vigilant about maintaining a sterile environment and prescribing prophylactic antibiotics. Additionally, it's not just the surgical technique that matters. How you manage the patient post-surgery can make or break the outcome. Patients with compromised immune systems or existing conditions like diabetes are especially vulnerable. So it's a team effort. Surgical skill, nursing care, and follow-up all contribute to preventing postoperative infections.
Now look at question 30.
How are you doing, Mrs. Williams?
Well, considering I've just had a new hip installed, I feel surprisingly okay. You said I'd be up and about sooner than I'd think.
Yes, hip replacement techniques have come a long way. You had a minimally invasive procedure, so you should be able to go home today.
That's fantastic. I had a friend who went through this 10 years ago, and she was in the hospital for days.
Times have changed for the better. You'll be using a walker for the first week or two, and then you can graduate to a cane. But I'd recommend no heavy lifting or strenuous exercise for at least 3 months.
3 months? Last time I had a minor surgery, I thought I could go back to my Zumba class in 2 weeks. That didn't end well.
It's crucial to give your body the time it needs to heal. When it comes to surgeries like this, rushing back into your regular activities could cause complications.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
I'm Dr. Lisa Johnson, a neurologist with a special interest in autoimmune disorders affecting the central nervous system. Today, I'd like to shed some light on autoimmune encephalitis, a condition that, despite its severity, is not as well known as it should be. Autoimmune encephalitis is a condition where the body's immune system mistakenly targets healthy brain cells, leading to inflammation of the brain. The symptoms can range from mild to severe and may include cognitive impairment, seizures, hallucinations, movement disorders, and even loss of consciousness in extreme cases. One of the puzzling aspects of AE is its wide array of presentations, making it a diagnostic challenge. The causes of autoimmune encephalitis are still not entirely clear. In some cases, it seems to be triggered by an infection or even a tumor elsewhere in the body. This is known as a paraneoplastic condition. However, in many instances, no such triggers are identified. It is a condition that can affect anyone, children, adults, females, though some forms are more prevalent in certain groups. One of my recent patients, a 29-year-old woman named Jennifer, presented with a sudden onset of memory problems, anxiety, and hallucinations. She had been perfectly healthy just weeks before and had no history of psychiatric illness. Her family was understandably distressed, initially suspecting she had developed a severe mental disorder. After conducting several tests, including MRI and lumbar puncture, we identified markers that were consistent with autoimmune encephalitis. Once the diagnosis was confirmed, we initiated aggressive immunotherapy. Jennifer responded well and is currently in the process of rehabilitation. The psychosocial impact of autoimmune encephalitis is enormous. Patients and their families experience a whirlwind of symptoms that mimic other disorders, ranging from psychiatric illnesses to other neurological conditions. This often leads to misdiagnosis and delay in appropriate treatment, adding another layer of complexity and distress for everyone involved. Another patient I saw was a teenage boy named Alex with sudden onset obsessive-compulsive behaviors and tics. Initially, the family consulted a psychiatrist, thinking it was purely a mental health issue. However, his symptoms escalated rapidly, leading to seizures. Subsequent evaluations pointed toward autoimmune encephalitis, and he was started on immunomodulatory treatments. His parents expressed guilt, wondering if they had missed something earlier that could have led to an earlier diagnosis. This underscores the importance of raising awareness not just among medical professionals, but also within the community. For treatment, immunotherapy options like corticosteroids, intravenous immunoglobulins IVIG, and plasmapheresis are often effective, especially if initiated early. Patients may require long-term follow-up and, in some instances, chronic immunosuppressive therapy. Regarding diet and lifestyle modifications, the evidence is still inconclusive. While general healthy living recommendations apply, no specific diet or exercise regimen has been shown to significantly alter the course of autoimmune encephalitis. More research is needed to explore these avenues. In conclusion, autoimmune encephalitis is a complex, multifaceted neurological condition that demands attention from a broad spectrum of healthcare providers. Understanding its varied presentations, improving diagnostic techniques, and developing more effective treatments are ongoing challenges in the field. Thank you for joining me today, and I hope this discussion has been informative and will help increase awareness and understanding of this challenging condition.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today I'm joined by Dr. Emily Thompson, a neurologist specializing in Parkinson's disease. Parkinson's is a progressive neurological disorder that can have significant implications for mobility and quality of life. Can you explain to us how common it is, particularly among the aging population?
Certainly, Parkinson's disease is the second most common neurodegenerative disorder after Alzheimer's disease. It usually begins in late adulthood and is increasingly common with age. According to estimates, the prevalence of Parkinson's ranges from 1% in those 60 and older to 4% in those 80 and older. The disease predominantly impacts motor function with symptoms like tremors, stiffness, and bradykinesia, which is slowness of movement. It also has a range of non-motor symptoms like cognitive decline, mood disorders, and sleep difficulties.
Can you describe a typical case from your practice?
Certainly. Let's call him John. John is a 67-year-old retired engineer who began to notice a slight tremor in his right hand a couple of years ago. Initially, he dismissed it as age-related, but his family urged him to consult a physician when they observed that he was beginning to shuffle when he walked. After a thorough neurological examination and imaging, John was diagnosed with Parkinson's disease. Like many patients, he was shocked because while he had some minor symptoms, he was still largely independent. This underlines the fact that Parkinson's is often asymptomatic or minimally symptomatic in its early stages, making it crucial to diagnose and manage it as soon as possible.
So how is Parkinson's disease usually diagnosed?
Diagnosis of Parkinson's disease is largely clinical, based on symptom presentation and neurological examination. However, some diagnostic tests, like DAT scan, an imaging test that looks at dopamine levels in the brain, can be used to confirm a diagnosis. Advances in technology have also made it possible to use wearable sensors that can monitor motor symptoms in a real-world setting, but interpreting these data still requires expert clinical judgment.
What treatment options are currently available?
Most treatments for Parkinson's aim to manage symptoms, particularly those related to motor function. The gold standard is levodopa, a medication that is converted into dopamine in the brain. However, its effectiveness can decrease over time, and it can also lead to a phenomenon known as motor fluctuations, which are periods when the medication's effects wear off and symptoms return. Surgical interventions like deep brain stimulation, DBS, can also be considered in more advanced cases or when medication alone isn't effective. Recently, there's been some promising research into gene therapy and even the use of gut microbiota to manage symptoms.
You're also involved in a telemedicine project for Parkinson's patients. Could you elaborate on that?
Absolutely. Frequent in-person visits can be challenging for Parkinson's patients due to their mobility issues. Our telemedicine project allows patients to consult with neurologists and receive physiotherapy online. They're also taught how to self-monitor their symptoms and medication effects. The goal is to enhance timely intervention, thereby improving patient outcomes while reducing the burden of frequent clinic visits.
Finally, what's your take on the role of stem cells in treating Parkinson's?
Stem cell research in Parkinson's is a topic of great interest, but it's still in its infancy. There have been a few trials where dopamine-producing cells derived from stem cells were transplanted into the brains of Parkinson's patients, with some positive results. However, there are several ethical and technical hurdles to overcome, like the risk of uncontrolled cell growth. The media often sensationalizes these findings, but realistically, we are still several years away from stem cell therapy becoming a standard treatment option for Parkinson's disease.
Thank you for sharing your valuable insights, Dr. Thompson. It's a complex issue, but it sounds like there are some promising avenues for future research and treatment.
It's my pleasure. Indeed, the future holds promise, and continued research is the key to unlocking more effective treatments for Parkinson's disease.
AVN Pharma Education.